Hey guys, so it's been a little while, I guess about a week maybe since I did a last video. I don't know, I didn't look to see, but it's been a few days since the last video I did talking about how I started the kind of like a modified keto diet for the Candida overgrowth that I'm having issues with. So I have a few updates, and day before yesterday I went to an immunologist and I didn't quite get answers like I was kind of wanting. But I guess that's okay because what he did do is he ordered more lab work. He looked at the lab work that I had given him that was already done, the blood work, and he said that it wasn't enough information. So he ordered some more labs to be done with more information. And the thing is, I have kind of an interesting relationship with this immunologist. So I saw him before for my allergies and asthma, and I ended up going away from him and going to somebody else. Like I have a new allergist now. Okay, it's kind of a long story. So I guess this video is going to be about my allergies and asthma. Let's go ahead and just start there. So I got diagnosed with asthma last March, so 2023. I guess it was like March, April, somewhere around there of 2023. And I have never had issues before with any breathing issues or asthma or allergies or anything like that. I mean, I had just your regular allergies, but nothing like severe or anything. So I don't know where all of this came from, but I got diagnosed with asthma and I got put on an inhaler. I was on Symbicort, and I've been on Symbicort. It's the one I'm on now, and I have been on it, since I was first diagnosed, and it worked great for me for a while. And then last year in the fall, my asthma started to kind of flare up again. And I don't know if it was just a change in the weather. I don't know what was going on. I know I had quit smoking last summer, and everyone had said that that was going to make me feel better. My pulmonologist had said that that was going to help with my asthma. But I noticed ever since quitting smoking, actually, my asthma seems to have gotten worse. And I don't know if that's just like a coincidence, probably. I can't imagine that smoking is actually good for your asthma. So I don't plan on going back to it. So my pulmonologist, when my asthma started flaring up again in like November, December of last year, had suggested that I go see an allergist because he said he couldn't really do much more for me. I'm already on, a good inhaler and everything, and there wasn't really. He had also added Singulair, so I was already taking Singulair, and I was taking Claritin for my allergies, and there was just not really anything else that he could do. So he advised me to see an allergist. So I went and I saw this allergist, and he's an allergist slash immunologist, and he, for whatever reason, didn't want to focus on my asthma, which was the whole reason I came. Instead, he assumed that I had some kind of mast cell issue. And so he ran some tests. He had me do like a 24-hour urine sample. He had like a whole bunch of blood work done to check for allergies. I don't know, for whatever reason, he didn't want to do a skin test. I think it was because I'm already on Claritin, but he could have gotten me off of Claritin. I know that now. I didn't know that back then, but he could have gotten me off of Claritin to do the skin test, but instead he opted to do a blood test, like a blood allergy test. And of course, those are notoriously inaccurate. And so when it came back, it showed that I wasn't allergic to anything except for mold, and that it was a very mild allergy. So he didn't really focus on my allergies at that point, or my asthma even. He wanted to focus more on this like mast cell activation syndrome. He saw, I think, 2 markers or something that I guess was good enough for him to go ahead and diagnose me as having mast cell activation syndrome, which kind of freaked me out. I didn't know anything about it, and he told me to just go home and do research. And then he put me on Ayvakit, which is like this super expensive medication that is for like mastocytosis or whatever. And it's like, what I've learned from my current allergist is that mast cell stuff is kind of on a spectrum. So you've got like, mast cell activation syndrome like over here, and then it goes like worse to mastocytosis or whatever. So it's kind of on this spectrum. So they're not like super different. Anyway, it's not approved. The medication is not approved for mast cell activation syndrome. It's approved for the other thing. And so, but he told me, here's where I had some issues with him. He told me that it was approved. And when I told the pharmacist, after I started taking it, I told the pharmacist, it was like a specialty pharmacy, that I'm taking this for the mast cell activation syndrome. And they said, oh, well, your doctor said you have mastocytosis. And I was like, well, he told me I have MCAS, mast cell activation syndrome. And she was like, well, the medication isn't approved for MCAS. So I'm just confused as to why your doctor would tell you that you have that and then tell us that you have something different. And so then I called my doctor's office and spoke with the nurse and asked her to please clarify, what do I have? What am I diagnosed with? And she said, I am diagnosed with MCAS. And so I said, okay, but the medication, the pharmacist told me the medication is not approved for MCAS. It's only approved for mastocytosis. And she came back, the nurse at the doctor's office came back and said, no, it is approved. It has been approved for MCAS. And I said, no, it hasn't. I looked it up and it hasn't. And the pharmacist told me it hasn't. And she said, well, that's just not true. It has been approved. So they were just blatantly lying to me. And so that really turned me off of that doctor's office. So I walked away from there and I went to see an allergist because I felt like he was not addressing my asthma. He was wanting to focus solely on this mast cell stuff, and that was not really my concern at the time. And so I spoke with my regular doctor about it, and she recommended that I go see a different allergist. So I went and saw this new allergist. I'm trying to not say names. So my current allergist now did a skin test on me, had me get off the Claritin for 5 days, went ahead, did the skin test, and found out I'm allergic to everything. And as far as my asthma, she actually had me try different inhalers. So the first inhaler that she had me try was Trelegy, and I had a terrible experience with Trelegy. At first it seemed okay. It seemed like it was kind of getting my asthma under control a little better, and I was like, okay, this is going to be good. But then after a week, I started noticing shortness of breath, and that was a little concerning. And so then my thoughts were to maybe go down to a lower dose of it, and maybe that would take care of that shortness of breath, but I would still be able to manage my asthma. So the doctor went ahead and approved that for me, and so we tried the lower dose of the Trelegy, and I ended up getting severe joint pain. It started mild joint pain, and I thought, well, if this is kind of a side effect that I just have to deal with, it's not that big of a deal. But then after a few days, it got bad, like to the point where I would wake up in the middle of the night in excruciating pain in my hands. My fingers it was excruciating pain. I would wake up crying, and every morning I would wake up and I would have to get in the shower and I would just run my hands under the water and just cry from the pain. It was so bad. It hurt to even touch, like my skin even hurt really bad. It was horrible. So I wanted to get off of it. And what was frustrating is nobody believed me that it was from the Trelegy. People were just saying, and these are I brought it up to multiple doctors, I brought it up to multiple pharmacists, and everyone was just saying, oh, it's just a coincidence, you're just getting arthritis at 35 with no history of arthritis or any kind of joint pains or anything like that. And so I was like, okay, I mean, I guess that's possible, maybe so. But it's just odd that it happened around the time that I've been on Trelegy or whatever, and that is listed as a side effect. Doctors were gaslighting me. Pharmacists were gaslighting me, trying to tell me that that is not a side effect, that joint pain is not a side effect of Trelegy. It absolutely is. You can look on the pamphlet that comes with it, and it lists joint pain as a side effect. You look on their website, it lists joint pain as a side effect. Like, it everywhere lists joint pain as a side effect. You talk to other people that have taken Trelegy, and some of them have had joint pain. Maybe it's not like as common, but you know what? It is listed as a common side effect. Maybe it's not as common as other things, but it is a side effect. And I was being told blatantly, outright, it is not. That I don't know what I'm talking about, and it is not a side effect. Pissed me off so bad. Like, that was like the last straw as to like medical mistrust that I have. Like, I have a really hard time trusting doctors now at this point, and any medical professional, really, pharmacists, anybody. Anyway, I took myself off of the Trelegy. I said, no, I want to get off of it. So I got off of it, got back on my Symbicort, and it took probably like 2 weeks before the joint pain got better. And then now it has completely gone away, and it's been a few months. So yes, it was from the Trelegy, and it took a really long time to go away once I stopped taking it. So that was my experience with that. But anyway, then after that one didn't work, she wanted to try me on Dulera. And so I tried Dulera, and I was only able to take Dulera for like a day and a half because it gave me panic attacks. My anxiety, it spiked it so high. I don't know if it was maybe just that particular steroid that was in it. My body just rejected like crazy. And yeah, so I could not do Dulera, so I had to go back on Symbicort again. The reason why we kept trying other inhalers though is because Symbicort, I kept getting thrush on Symbicort. And so we were kind of blaming that particular inhaler, and so trying different ones. Well, now with all this new information that I have about myself and my immune system, it's kind of come to my attention that maybe the problem is not necessarily the inhaler, because there are other people who use Symbicort and don't have thrush. You know, there's some people that maybe they get thrush like once a year or something like that from it, and there's some that have never had it. And so it can't just be the inhaler's fault. And it's got to be something to do with my body, like the way that my body is reacting to it. So it's got to be the immune system. So I think, as I stated before, if not, I don't remember what I had updated, but I got recommended to go see an immunologist. Unfortunately, the only immunologist that takes my insurance is the same allergist / immunologist that diagnosed me with MCAS that I had gotten away from. And I don't know how he is with immunology. Maybe he's a great immunologist. I just didn't think that he was actually paying attention to my asthma and the issues that I came in with. I just didn't really have a good feeling about it. Now, maybe he can help me with the immunology. However, this time I don't really have a good feeling either this time, because I went and saw him and he didn't really say a whole lot about my immune system. All he did was he got more blood work, which we're going to see the results of that. I see him again in 2 weeks, so we'll see what that says. But he just wanted more blood work for the immune system. And then he kind of shifted the topic to my asthma, which is odd because he didn't really want to focus too much on that last time. But this time, all of a sudden, he wants to focus on my asthma. And so I told him my asthma seems to be kind of okay right now. It's just my allergies. And I had asked him if it was okay for me to go ahead and do allergy shots with the other allergist that I see, that the one that's taking care of my allergies and my asthma. I just showed him the piece of paper that showed all of everything I'm allergic to. I wasn't trying to like be confrontational or anything. I was just showing him like, look, it turns out I'm allergic to everything. And, you know, is it safe with my immune system being as low as it is? Would it be safe for me to do allergy shots right now? That's what my allergist had told me to ask him, because my allergist is not an immunologist and he is. So he looked at the paper though, and he said, oh, this place is an ear, nose, and throat place. And our skin tests are better because ours are more thorough. So I want you to do ours. And I was just like, okay. And so I got my paper back And then he started going on about how he wanted to take me off of Symbicort and put me on Anoro. And at first that put me off because later I found out Anoro is for COPD, not for asthma. It's not been approved for asthma. My current allergist made me feel a little bit better though when she said that a lot of times doctors will use things off label. So she said that's not a red flag to her or whatever, that, you know, that's not unusual to use a COPD medication for asthma or whatever. And he wanted to put me on Anoro, and he wanted to take me off of Symbicort. And Anoro does not have a steroid in it. And so I see what he was trying to do. He was trying to get me away from steroids. And he said that my asthma may not have inflammation. And so the steroid is really only for inflammation. The bronchodilator is what opens up your lungs. And Anoro is a bronchodilator, just like Spiriva is a bronchodilator. Well, I told him what happened with Spiriva, how I had a reaction to it. I had the opposite, and it closed everything up, and I've stopped taking Spiriva. And he said, well, these are two different medications, though, so it may not happen. Which to me, of course, me being like kind of high anxiety, I'm just like, if there's a chance it could happen, I don't want to do it, you know? So anyway, he wants me to go on Anoro. He wants me to get off of Symbicort. And then I asked about, well, what about the inflammation if I do have inflammation? And he was like, well, we'll test you for inflammation. So he went ahead, he had me breathe into a little tube and tested me for inflammation. Then he was just going to let me leave the office. Then everyone, you know, the nurse, everyone came back and just said, yeah, doctor said everything looks good. You can go ahead and go. And I was like, wait a minute, I want to know the results of the breathing test though. Like, do I have inflammation? And she was like, well, okay, follow me. And so she brought me back into his office, and I had to ask, like, do I have the inflammation? Like, that's what you were testing for. And I said, so you said everything was good, so I don't have inflammation then? He was like, oh no, you do have inflammation. I was like, okay, so then what are we going to do about that? Because you're wanting me to be off the steroid, and the steroid takes care of inflammation, so how are we going to handle the inflammation? And he said, well, there's other drugs that handle inflammation that aren't steroids. And I said, okay, like what? And he said, well, like biologics, like Tezspire. And he specifically said Tezspire. And I was like, oh, biologics, okay, like Xolair, which is what, when he diagnosed me with MCAS, he wanted me to go on Xolair, you know, after a while. After the Ayvakit didn't work, he said we can try Xolair. Or no, he wanted to try Dupixent. My insurance doesn't cover Dupixent unless you've tried Xolair. So then he was going to put me on Xolair. Then I got away from him and I went to a different allergist, and she said that I was not ready for biologics yet, that she was not yet convinced that I need biologics. And now here he was again trying to put me on a biologic and a bronchodilator and take away my steroid inhaler. So to me that just didn't feel right, but I just said okay, and I left his office, went home, immediately scheduled an appointment with my current allergist and got in next day. So that was great. So yesterday I saw my current allergist and I told her everything. I told her how the appointment went. I told her what happened. I told her what he wanted me to do now. And she said that he was jumping the gun, that she felt like he was jumping the gun, and that in her opinion, I don't need to get off of Symbicort just yet. She said that's something that we can discuss in the future as a possibility to maybe not need the steroid anymore. But she said, you're not there yet. You're not at that point yet. We want to go slowly. And she said that biologics are not something that she would consider at this moment, that she basically felt like he was just kind of, in her words, like bulldozing over everything and trying to take over my entire care. And that's not the reason I was there. I was not there to change to him for my allergies and my asthma. I was there for immunology. And so that was very disappointing. But my current allergist did say that, you know, I should still see him again for immunology and definitely get those test results. But she said, as far as like my asthma and stuff goes, she said the only thing that she would change right now is she would recommend I start taking, instead of just one Claritin a day, take 2 Claritins a day, one in the morning, one at night. I have tried that in the past, however, and it did kind of dry out my lungs a little too much. And so she said in that case, I could just take half, like take a half a Claritin in the morning and then a whole one at night. So today is the first day trying that. I took half my Claritin this morning, and so far nothing bad has happened. I don't really notice super drying or anything. I do notice a little bit of a stinging in my chest, but maybe that's something that has to get used to. My body has to get used to it or something. I don't know exactly how it works. Real quick, just interjecting here. Sorry, I finished the video, didn't even think to like mention this, but I am not going to go ahead and do what the immunologist said. I am staying on my Symbicort inhaler. I'm not going to do the Anoro and the biologic right now. We're just waiting. I don't remember if I said that or not, but I'm just inserting it here. All right. We'll see how that goes, but that was really the only thing. And then she prescribed me some ear drops because my ears have been itching. And I was worried that maybe it was the fungus, maybe it was the Candida spreading to my ears or whatever. And so I had her look in my ears, and she didn't see anything. And she said that she would give me some ear drops to maybe help with the itching. She said it was most likely allergy related. I don't know. We'll see. So yeah, that was my experience with the immunologist. And so that's kind of where we are now. At this point, when it comes to my thrush and the Candida and all of that stuff, I am waiting for it to come back right now. There have been signs that it might be coming back soon. I've started feeling a little bit of like a pinching in my throat, which has always been a sign before that in the days to come it will develop. So I'm starting to feel that a little bit. There's a little bit of whiteness on my tongue, not a ton, and I can scrape most of it off with a tongue scraper, so I'm thinking some of it is probably just a dirty tongue. But what we're doing right now is I'm waiting for it to come back so that way I can call my doctor's office and try and come in just for not a full appointment, but just to get a swab, because the infectious disease doctor, in order for me to even get an appointment with her, she wants a swab. She wants a routine fungal culture, which I guess takes like 30 days for it to process or whatever. Like you do the swab, you send it off, and it takes 30 days to get the results. So I'm kind of waiting for that to happen. Which fingers crossed that it just doesn't come back. I mean, that's something, when I saw my doctor this last time, my primary care doctor this last time, she was like, that's great that it hasn't come back yet. It's been, a week since I stopped nystatin, and it hasn't fully come back yet. And usually it's at least partially back by now. And actually by now, this would be like day 9 or something. Usually by now it would have been back full force. So fingers crossed, knock on wood, that it just doesn't come back. That would be great. And then I just don't have to go see an infectious disease doctor, and I don't have to see an immunologist anymore, and my immune system can just help rebuild itself. Because that's the thing, if I wait long enough, my immune system might actually come back. Because I wasn't, as far as I know, I wasn't born with like an immunodeficiency or anything. As far as I know. My immune deficiency comes from medication use, from using an immunosuppressant. And so I'm no longer on that medication anymore, so it should take around 6 months for my immune system to rebuild itself. So eventually my immune system will probably do its job and get stronger and healthier and start working again, just naturally, especially since I've changed my diet and I'm eating healthier and taking vitamin C now and eating blueberries and spinach and stuff that's high in vitamin C and in all the good stuff that helps your immune system. Now that I'm doing that, my immune system will eventually get better, but I just wanted to see an immunologist to kind of speed up that process, because I didn't want to wait and continue getting thrush if I didn't have to. So yeah, so that's kind of where things have been right now. As far as my diet goes, what I'm doing is I'm doing a modified keto. Basically, I explained it in the last video, but in case you didn't watch that video, I'll just briefly explain it. It is like keto, except I'm allowing myself to eat like complex carbs, like good carbs or whatever. Like I'm not eating regular bread, and I'm not eating rice of any kind, no tortillas, nothing that's, no potatoes. I don't eat potatoes anymore, but I am allowing myself to eat quinoa because the type of carbohydrate that quinoa is, I guess it doesn't feed candida like other carbs do. I don't know why. I don't know the science behind it, but that's just what I've read, is that quinoa is perfectly fine on a candida diet. And I'm allowing myself sourdough bread in moderation, because sourdough specifically does not have yeast. It's not made with yeast. And so it's a better bread. You know, a lot of people that do candida diet will say absolutely no bread at all, but then some people say you can have like a yeast-free, sugar-free bread, gluten-free. And the sourdough, I don't know if it's gluten-free, I don't know if it's sugar-free. There might be like a little tiny bit of sugar in it, but I know it's definitely yeast-free, which is a big thing. So I'm allowing myself some sourdough bread. I allow myself to eat beans because they're healthy. Yes, they have carbs in them, but it's not like terrible carbs, and they're healthy in other ways for your body. And so I'm allowing myself that. And oh, well, like also this past weekend, I went out of town and I allowed myself to have a little bit of Coke, which is the first sugar that I have had since starting this diet. And I was a little scared, but I was like, you know what? I have a doctor's appointment coming up. If I get thrush, I get thrush, and we can do the swab and get it over with. So I just allowed myself to have a little bit of Coke, and I allowed myself to eat pizza. And more on that next time, but I can eat certain foods now. I am so excited. I can eat cooked tomatoes. I can eat cooked onions. I can eat spinach, of course. I can eat cooked bell peppers. Foods that I couldn't eat before, or I was too scared to try because of my reactions and everything, I can eat them now. I don't eat them raw because I'm still scared of reactions, but I can eat them cooked now. Yay! So that opens up more healthy foods that I can eat. So yes, so I allowed myself to have pizza, which does have carbs, but it also has tomatoes, and I did great with the tomatoes. You know, it has regular cheese, non-lactose free cheese, and so I did splurge, I guess, with my candida diet / keto diet, whatever. But you know what, it didn't, I was afraid that the thrush was going to come back next day, like my throat was going to hurt immediately next day, and it didn't. So I know some people might say, you know, if I do end up getting thrush tomorrow or the next day or whatever, like now, people would probably come at me and say, oh, it's because you allowed yourself to have, you know, carbs and sugar or whatever a few days ago. And it's like, is it, or was it inevitable? I don't know at this point. I'm not too worried about it right now. I have some nice statin on hand if I have to use it again. If I do get thrush, it's kind of a good thing because then I can get that swab. But fingers crossed it doesn't come back. So yeah. All right. Anyway, it was kind of a long video. Well, I don't know if it was long or not. We'll see after I edit. But yeah, anyway, thank you for listening to me. Thank you for watching the video. If you want to tell me anything or just say hi or have any questions, leave them in the comments. And if you like the video, go ahead and leave a like. If you want to see more and you want to follow me on my journey, then you can go ahead and subscribe. And I will see you guys next time. Bye.